Hello and welcome. I am Dr. Carolyn Montoya. I'm the Associate Dean of Clinical Affairs at the College of Nursing, Health Sciences Center, University of New Mexico. I want to welcome all of you, preceptors and others that may be joining for this presentation on wellness and resilience, preventing clinician preceptor burnout. I know that all of you have done a tremendous job over the past year in terms of adapting to the circumstances that you are in. And many of you are precepting APRN residents at the same time. So I just want to tell you how very much you are appreciated as a clinician and also as someone who is willing to teach the next generation of advanced practice nurses, nurse practitioners, and nurse midwives to follow through your example and helping them feel very comfortable with their skills and their knowledge. So, having said that, we are going to go forward and talk about how you can stay well in all these times of great deal of stress and how you can work on your resilience to continue the wonderful job that you do taking care of patients and families, and we want you to take care of yourself. All right, so we're going to talk about resilience and wellness, and this first slide I took from the National Academies of Science, Engineering, and Medicine. This is a 2019 report that I will talk about in the other slides. But one of the nice things that the Academy did is they actually had an artist, Tia Calvert, who submitted this painting to really capture what was going on in terms of what she saw as what healthcare providers are really committed to. So the title of the painting is Woven, and I am going to read it directly, the artist's statement directly from the slide. Working at a healthcare organization, I see the effects of burnout, but I also see resiliency in our providers. Woven, which is the painting, represents the intricacies, layers, and complexities of feeling burnt out while serving patients. It doesn't happen all at once, but builds over time. The shimmering threads represent life and hope that is embedded in each provider. The spirit of serving and the belief that you will make a difference. All of these aspects woven together are the essence of the provider. This is who you are. As I mentioned before, I am in academia right now, but I am also a pediatric nurse practitioner. And up until I got it deep into administration, I continued to practice for a really long time at the same time as I was teaching. And I know what it's like to be in a very busy practice. I know the pressures of a practice. I certainly can't say I know what it's like to practice under COVID-19, but wow, again, that puts quite the strain on everyone, not to mention the fact that you are precepting. I also precepted in my practice, so I know what it's like to precept students and at the same time trying to maintain that care that we give, that individualized care that we give to our patients. So I would say that it really is about the spirit of serving and the belief that you will make a difference as a provider. So this is just a lovely portrayal of that, and something for you to keep in mind when you may be feeling down, that there are others that know just what you're going through. So one of the main, I want to say, main way of optimizing a health system is something called the triple aim. And I took this from one source that was in 2014. However, if you read about healthcare in general, you're going to see pretty typically that the literature speaks to the triple aim of healthcare. And that triple aim, of course, is having a positive patient experience and improving patient health and, of course, reducing costs. So these are very important for any system, any healthcare system to look at. How are things affecting the patient? Is it in fact improving the health of the population that they serve? And is it being done effectively in a cost savings way and not overspending? So definitely important. However, recently the literature has also come up with what they call a fourth aim. And that fourth aim, or the quadruple aim, is prevention of burnout. It has really become very, very prominent that burnout, if you don't include this and have four aims or the quadruple aim, what is happening with burnout is you're not enhancing the patient experience, you're not improving health, and your costs are going up. So this has become quite the focus within the literature and within healthcare systems, is how do we prevent our healthcare providers from burning out? So again, the National Academies of Science, Engineering, and Medicine published a report in 2019 that basically spoke to burnout and resilience and well-being for providers. And they talked a lot about clinician burnout. In fact, the report is over 300 pages long. You can find it online. You can actually get it for free. I went through a lot of the report. I can't say that I read all 300 pages. However, it tells you that this is a big problem in healthcare and that there is a true commitment to solving this issue and treating burnout per se. So we know that it's a problem for both clinicians and patients. And as I said before, if someone is burned out, well, it's not very, it's not going to provide quality care from providers who are burned out. Obviously, then it is expensive for the organization. Burnout is multifactorial. There are a lot of things that contribute to it, but overall, the literature talks about the exhaustion that occurs, this depersonalization where the provider may become very cynical, and then you just don't feel like you're accomplishing what you wanted from work. You feel a low level of accomplishment rather than feeling that you, again, as that painting showed at the very beginning, that you have made a difference. I don't think there are many healthcare providers that go into healthcare and want to see patients every 10 or 15 minutes. Sometimes as the schedule is made in that manner. They have gone in because it's not about volume, it's about the difference that you can make in the care that you're providing. And I think that that is one very strong incentive when we talk about what it is that we do. I know for myself as a pediatric nurse practitioner, the best day for me was when I had really connected with the patients, connected with the family, and had done some teaching, done some education with that family that improved how they worked with their child, or helped to solve a problem, or helped them to know how to solve a problem. And that's what becomes so important and so rewarding, and why you keep doing that. Finally, this last bullet on this slide talks about clinicians who suffer burnout tend then to be poor role models and not very good teachers for the students. And then that just permeates the trainees' experience of what they are doing, and also can lead to them having really early burnout. So this is why this topic is so important and so seminal, particularly at this point where we have faced the challenges of COVID-19. So as I said, the Academy of Science recommendations, the book itself is very lengthy in the 300 pages. However, they did come up with some general recommendations that I've included here. And certainly the first of those are positive work environments. And as you'll see in a video that I'm going to show later in this presentation, one of the very positive things is that the researcher talks about is the great effect of positive thinking. And one of the things that she talks about is that having a thankful board in your clinic or in a unit where you have a whiteboard and you come in, and each day the providers who are there write down something they are grateful for. And soon that whole whiteboard is filled with grateful sayings. And you know, if you're coming into your clinic in that manner and you see this, that is very positive and very reinforcing and helps to lift your attitude as well. In terms of learning environments, we certainly want to optimize those learning environments, both for yourself and for the learner, and just foster that well-being with the residents that you are working with, that you want to be sure that you know, you are presenting things in a positive way. Administrative burden is huge in the healthcare system. It has just gotten that way, gotten more so, I think, that way over the years. I know that when we first went to electronic charting, and I was in the practice I was in a private office, and we got electronic charting, I'll tell you, I came this close to quitting. It was so onerous. It was so time consuming. And again, I was spending more time with the computer, looking at the computer, than I was with the chart. And it was so, rather than I was with the patient, it was so demoralizing. And while there's been great improvements in electronic charting, there still remains a lot of challenges that are difficult to overcome. And that's one example of administrative burden. It can also be, you know, again, I talked about the schedule. How are you being scheduled? Is it an adequate amount of time to give the care that you want to give? And then there's all of the paperwork that you have to fill out, as well as all of the things that you have to do to maintain your license. So there is this administrative burden for sure. And most healthcare organizations try to work to minimize and to get input. One of the things I was very impressed with a couple of weeks ago, I was in a meeting with the Presbyterian personnel, the advisory committee for this grant, for this HRSA grant that you are all participating in the APRN residency. And I was very impressed with the fact that they had done a survey in December about with the preceptors in terms of how things were going. And that's a great thing to do, because then they're able to act on those things and not wait till a program is over to take an evaluation, but what's happening at this time and what could we do to make this better? And so those are some strategies that are always helpful. Certainly technology, we've talked about electronic charting. Are there other technologies that may decrease that administrative burden? And then support for clinicians and learners. So I'm going to talk about some of those that are specific to the Presbyterian organization, who have quite a bit of support for their clinicians. And again, to help ease that burnout, to try to prevent that burnout. And then, of course, research is something that we always talk about. What are strategies that work, that prevent burnout? Or what are strategies that help to reduce stress? And again, I have a video that I'm going to show you in here that's going to address those issues from a nursing researcher. So what is in the literature in terms of resources and strategy to relieve preceptor burnout in nursing? Well, there's not a huge amount of literature for advanced practice nurses. There's a lot of literature on burnout among registered nurses, and you can find a good bit of literature there. What I did do is I tried to look at some resources that are currently available for the nurse residency, nurse practitioner or APRN residencies. And so the first one is a book called Residency and Fellowship Programs for Nurse Practitioners in Community Health Settings. And this is was published in 2017. It has a great section on the curriculum and how a nurse residency should be run for APRNs. But there's no specific guidance in there that I could find related to burnout. There was a little bit about precepting in general, just a couple of pages. Now, in just the opposite of that is the National Organization of Nurse Practitioner Faculties, and I've given you the link on this slide. And they have a booklet, a guide really, on partners in NP education. This lays out nurse practitioner education, lays out in great detail exactly what is necessary in order to precept a student. Now, this is not a residency student, but this is a student who is in a nurse practitioner program. And so it talks about the clinical experience, it talks about the paperwork you need, but I didn't really find anything in there about burnout. It talks a little bit about the relationship between the preceptor and the student, but again, nothing related to burnout. One of the nice things that NOF, or the National Organization of Nurse Practitioner Faculties, does supply is these preceptor portal vignettes. And you do not have to be a member of NOF to access these. And I believe that in previous presentation, you may have seen one or two of these. But these are the current vignettes that are available on this site. Precepting primary care NP students, very brief video. And I think the next two are really, or actually the next three are really good. One is working with an overly confident NP student. And in this case, it might be for you working with an overly confident APRN resident, or working with an APRN resident who's overly sensitive. And then finally, how do you precept in a busy clinic? And I had the clinic that I was in as a PNP was extremely busy, particularly in the winter months when you had influenza and you had RSV, plus the regular well-child kind of schedule. And it isn't always easy to work with someone that you're trying to precept and at the same time give really quality care to your patients. And I think that vignette is very helpful in assisting you to do that. So some strategies that I found, again, remember I said that most of what I see in terms of burnout is about burnout at the undergraduate level or those new RNs. But these may apply a little bit to the APRN residency preceptors. Obviously, you want to have a good orientation. And I think you all have a really, really excellent orientation that's being done by those on the grant. It sounds just what it should be and that it's up to date. And then classes for the preceptors as well as some ongoing training. And what are the opportunities for professional growth? Again, I think Presbyterian does a great job with that in offering things that would be pertinent to all of you. Management support, and you certainly have support from the people who are involved in the grant and will help you in terms of if you're coming across a roadblock. And I mentioned before, by surveying, by seeing what concerns you have at this point and how they could improve the program. There's a lot of structure, I think, within the APRN residency program, so that's a good thing, and structure always helps. And then the quality improvement projects that can be done. And Presbyterian does a really excellent job with the plan, do, study, act cycle so that you're not festering. Something doesn't fester for a long, long period of time and then sort of becomes an explosion, but rather what is it that they can see, what kind of quality improvement project can be done to improve a process. Kemper talks about students being well prepared, and That, of course, is up to the program that they went to. And I think we feel very proud of our program here at the College of Nursing at UNM in terms of our APRN programs, that we give a lot of individualized attention to our students so that they are well prepared when they may go into an APRN residency. Obviously, you need adequate support for preceptors. What is the workload that you're doing? What are your responsibilities? What are the time requirements that go in? And then I think another important item that's often missed is conflict management. Conflict is inevitable just in about any position, any job that occurs. And having some ability to manage the conflict, and I'm going to talk about that a little bit more when I talk about how we make our judgments and using a ladder as a model. Modic, what I liked about this article, and it has gotten a lot more attention now, is just the whole concept of civility and the fact that there are microaggressions that occur in any workplace. And certainly this has been documented in nursing. So one of the things that you can do is just engage yourself in how you see things and self-reflection, and thinking about how it is that you arrive at a conclusion. So one of the things that Modic talks about is this ladder of inferences and how you make those decisions. And then, of course, she also mentions that you yourself need to be well. Are you physically active? Are you eating well? Are you sleeping well? All of those very good things. So this is the model that I like a whole lot, this ladder of inference. And you can see this, I picked this particular representation, but there's lots of images about this, and you see it a fair amount in literature if you look it up. And as you can see, most of the time it's that we may be in a setting and we observe something happening, and then we sort of go through these steps here of selecting what we're looking at, what we assign a meaning. We may assign an assumption, we come to a conclusion, it's based on our beliefs, and then we take action. So this happens for most of us without a lot of taking a moment to step back and think. So oftentimes it is we observe something and all of these rungs in the ladder take effect, and we move right away to action. It's very reflective. Our beliefs influence what we observe. So what this is giving us a chance to do is to take a minute and think. You know, what is it we really saw? How much of this is being affected by our beliefs that we have and the meanings we assign to things, without taking a moment to think about what it is we really did see and what should be the next step. I always liken this to two things in my professional career, particularly as an academic person. When I started going into leadership in an advanced level, I thought, wow, I'm just going to help people and I'm going to solve this problem when they come to me, and I'm going to solve it right away. And what I learned from that is I was moving too quickly to a conclusion without getting enough data. And I now have a saying to myself, there are few things that must be solved immediately. Now, in your case as clinicians, and even for me as an academic, there are issues of safety. You have to act when you are talking about the safety of a patient. I have to act immediately if a staff, faculty, or student is in an unsafe position. That requires some immediate action. But in academia, there's few things other than that safety issue that require a quick decision. So I have learned not to hit that send on the email, but if I'm upset and I really write it, I just don't hit send. I need to consider it. Do I have enough data? Have I spoken to everyone I should be talking to about what is occurring before I jump to making a decision about what needs to be done. And so I would just say, as leaders that you are in the clinical setting, think about that as well. Maybe just back off for a little bit. Think about what it is you saw. Could there be a different interpretation here? And so try to slow down that the rungs on that ladder. So well-being and resiliency, what do we mean by that? Well, well-being is what I mentioned before, is what's your physical health? How are you eating and sleeping in your activity? And certainly the challenges of COVID have made all of this very difficult. If you read some of the reflections that people have about COVID-19, some of what I have read has been the very intense dreams people are having. And I would say that's been true for me. These dreams just much more, not a nightmare per se, but just intense situations that seem to have invaded my dream cycle for sure. Baking. My youngest son was recently visiting and he said, "Really, mother, how much yeast do you need?" And I was saying, well, I bake bread. So maybe it was a little too much bread baking going on. And then, of course, there's your mental health. And one thing I don't want to leave out is spiritual health. And all of those things contribute to well-being. Resiliency, as we hear, is that ability to recover from difficulties, and how quickly are you able to spring back? You hear that a lot. And how much of uncertainty can we tolerate? And again, in COVID-19, we saw a lot of uncertainty. You wear a mask. No, you shouldn't wear a mask. Maybe you should double mask. When the pandemic first hit, what did you see everybody rushing to buy? Toilet paper, because there was some uncertainty about would there be enough. So the stores were wiped out of of that commodity and other commodities as well. Things like masks were difficult to get, or cleaning supplies were difficult to get. And again, you have people that maybe just took an enormous amount of supplies because they were so uncertain about the future. And again, that affects your resiliency. So a great source for clinician well-being and resilience is the National Academy of Medicine. They have this collaborative on clinician well-being and resilience. And you can find a lot of resources here, things right now like COVID-19 resources, studies related to this, and just this really nice clinician well-being knowledge hub. So again, if you notice that one of the statements on this side says, clinician well-being is essential for safe and high quality patient care. So your well-being is important to you as a person, important to your family, and definitely important to the place that you work. So the American Nurses Association has mental health resources. There's a lot of videos that you can view on different mental health issues. And what I liked about most of the ones that I looked to, they were very short. I think there was at least one or two that were over a half hour, but the majority of them were short, like 13 minutes or 15 minutes. And I'm going to show you one in a moment here that is like that. So you can go there, and you don't have to be a member of ANA to access these resources. And again, I've given you that link. It's a long one, but even if you just type in ANA COVID-19 or ANA mental health, you should be able to find those easily. So resiliency, again, how do you spring back? How do you come back from something? Well, I'm going to show you a video, and this is by Dr. Bernadette Melnick. She is the professor and dean at the College of Nursing at Ohio State University. Dr. Melnick is known for her work on psych mental health. And recently she has really delved, well, not recently, actually for quite a while, has delved into the area of well-being and what that means. So I am going to collapse this PowerPoint presentation, and we are going to go to her video.
A lot of people misperceive resiliency. Many people think you're either born with it in your genes or you're out of luck. Studies have shown resiliency can be built and strengthened with practice. And that's what I'm going to encourage you to do today. Just take 5 minutes every day and practice one of these resiliency skills. So as part of the National Academy of Medicine's work, our team just released and published a rigorous systematic review that we conducted over the past 18 months on interventions that were most effective in improving mental health, well-being, physical health, and healthy lifestyle behaviors in physicians and nurses. This is what we found. Mindfulness works. It's an effective strategy, particularly for stress and anxiety. Gratitude works. This is a gratitude board that I would suggest putting up on your clinical units or at home. So when you walk in, write down 2 or 3 things that you are grateful for. This is a board that was developed by one of our units here at Ohio State. And people talked about the difference it made every day when they walked in to take care of patients. Cognitive behavior therapy or skills building works. And I'll talk about that in a couple of minutes. Lastly, taking just 5 big, deep breaths 5 times a day, using the 4-7-8 method works to decrease stress, anxiety, and decreases blood pressure. Take 4 seconds to take a deep breath in. Hold it for 7. Then blow out, counting to 8. Again, what's really easy to do is when you're washing your hands for 20 seconds, use that time as a recovery break to practice 2 big deep breaths using the 4-7-8 method, or to practice mindfulness. If you can take these short recovery periods during the day and practice these simple tips, your mood is definitely going to be better. Well, for the last 25 years of my career, I have developed and tested cognitive behavioral skills building interventions for children, teens, and clinicians. Most recently, we developed an 8-weekly session program. We tested it with new nurse residents. And what we learned is just teaching them cognitive behavior, therapy-based skills. And this program is manualized, so it can be easily done in short 30 to 40 minute sessions with groups of nurses. But teaching them these skills resulted in decreases in depression, stress and anxiety, and improvements in job satisfaction. In CBT, we teach people the thinking, feeling, and behaving triangle. That is, how we think affects how we feel and how we behave. So I'm going to ask you, monitor your moods throughout the day. When you sense your mood is changing, you're getting angry, stressed, depressed, or anxious, I want you to say to yourself, what was just going through my mind? Is that thought really true? Is this thinking helpful? And do I have evidence to back it up? In all probability, I can tell you it's probably not true and it's not helping you. So when you catch yourself having a negative thought, turn it around to a positive and watch your stress, your anxiety, your depression improve. We need to program our brains every day with positive thinking. Our brains are like a computer. Positive in, positive will come out. We have to remember the majority of causes of depression, stress, and anxiety are negative patterns of thinking. So if we can change our thinking, we can feel better and change our lives. One quick strategy to help with positive thinking is to get up every morning and before we go to bed at night, say 10 positive self-statements. Whether it's I'm going to stay calm, I am healthy and strong, even if you don't believe them when you first say them, your brain will be processing those positive statements, and as a result, you're going to feel much better. The other habit I've created for the past 20 years is reading just 5 minutes in a positive thinking book every morning and every night. Try it just for 30 to 60 days. Give this strategy a try. You will be amazed at how much better that you feel. Mindfulness, as I talked about, works. So if you're starting to worry, I encourage you, take a moment, turn your head to the left, and then slowly turn it to the right, saying to yourself, what am I seeing, feeling, hearing, and sensing right now? Bring yourself back to the present moment. Currently, there are some wonderful free apps, such as Headspace is making their app available for clinicians through December. Try this app. Try just a moment of mindfulness a few times a day. As I mentioned before, gratitude. has such great evidence behind it. Waking up in the morning, saying 2 or 3 people or things you're grateful for. Research has shown daily gratitude practices increase optimism, improve sleep, and decrease diastolic blood pressure. But just like behaviors take 30 to 60 days to change of consistent practice, so does positive thinking. Again, practice some of these techniques just a few minutes in the morning and at night and see the difference that it makes. Well, 1 out of 2 people in America have a chronic disease. But what's sad about that is 80% of chronic disease is totally preventable with just a few healthy lifestyle behaviors, such as physical activity, 30 minutes, 5 days a week, healthy eating, just 5 fruits and veggies a day. Don't smoke, and if you don't drink alcohol right now, don't start. But if you do, I encourage you, follow the CDC's evidence-based recommendation of no more than 1 drink a day for women, 2 drinks a day for men. Everybody then asks me, how big can that drink be? But I tell everyone, not the size of the alcoholic beverages we get in Vegas. Put 7 hours of sleep on top of those 4 behaviors and regularly engage in stress reduction, and your risk of chronic disease is going to drop even further. Practicing these healthy behaviors now in lieu of this pandemic is so critical to keep our immune systems functioning at their peak. Lastly, stay hopeful. There are silver linings to this pandemic. This is a photo of my 2 character building pugs. They see the silver lining to the pandemic being at home with us while we're working. But remember, rainbows follow rain. There are going to be lots of silver linings.
So I hope that that video by Dr. Milnick was helpful for you. And again, I want to reinforce that she has done lots of studies throughout her career on mental health and has been very engaged in wellness. In fact, she is, you can see from her slide, that she is the Chief Wellness Officer at Ohio State. So these are not just things she's thought of. These are things that she has studied and has shown that actually make a true difference in what you do. So let's talk a little bit then about what resources are available to you. And Presbyterian has a whole host of resources. One of the things I appreciated was the Code Lavender. And this is for employees who need immediate mental health support on the job. Certainly they have fitness challenges, they have webinars related to health. There's a wellness webinar called Nourish Your Green Zone. There's cooking classes, fitness classes. And for those of you that are in a rural setting that maybe are not in the Albuquerque area where you have access to some of those things on site at Presbyterian. They do have some Zoom options, these drop-in meditation sessions, or you can meet with a health coach. And then ECHO, they have certainly ECHO presentations and one on well-being and burnout, confidential phone support, and then just other resources, video counseling, webinars, professional counseling, and stress management. All of these things that demonstrate that press does value who you are, and in doing so, with the hopes that they can ensure your well-being. So these are great resources to have. As a pediatric nurse practitioner, I don't think there are many presentations I do without bringing children into them at some point. And I am sure there are those of you out there who have children and who have experienced the stress, your own personal stress, but also the stress that your children may be dealing with. And so I thought it was worth mentioning there are resources for children as well. And of course, I'm citing the American Academy of Pediatrics, and they have a healthychildren.org where they have a section on emotional wellness and some things that you can do to help reassure your children about what is going on in the world, and also help them develop some resiliency in these very difficult times. So last but not least, this kind of goes back to how I started the presentation, which was all about why we are healthcare providers and what it is that makes being a healthcare provider so important to us, and the great satisfaction that we get from what we do in a clinical setting. So sometimes when we're experiencing burnout, that comes, in this poem, it talks about the loss of connection to our patients, the loss of connection to ourselves and those that we love. Think about the nurses who have been taking care of COVID positive patients in an inpatient setting, then have to go home and take everything off and shower because they're so afraid that they would be transmitting the virus to family members. So oftentimes we focus a lot on tasks and tests and diagnosis, which are all very, very important. But what most patients really crave is this feeling of connectivity. So a good example of this is the COVID-19 vaccine. I am very interested and do a fair amount of reading on vaccine hesitancy and what the literature says about vaccine hesitancy. And the reason I bring this up is because the number one evidence-based strategy, if you want to change someone's mind about getting the COVID vaccine, is the relationship they have with their healthcare provider. That is who they trust the most. And if there's a strong relationship there and they are having doubts about the COVID-19 vaccine, that is the key to making them go from vaccine hesitancy to taking a vaccine. So it really is important, that connection that we make with patients. So last but not least, the remainder of the slides are the references. I also want to say a thank you to all of you for all that you are doing. I know that this has not been easy, and this has been probably one of the hardest times that many of us have faced. However, you, in addition to providing the excellent care that you do, you are also invested in the learning of others and the residents, the nurse practitioners, and the midwives. So you need to pat yourself on the back. You need to recognize that what you're doing is truly important and truly valued by your organization and by those of us who do teach. So I want to thank you for all that you do. I want you to stay well. I want you to remember to take those deep breaths and slowly let them out. And again, that you are appreciated for your service. These last are just the slides, and I have included the PowerPoint handout. So thank you very much and have a great rest of your day.